The commonest cosmetic surgery operation in the world today is breast enlargement or breast enhancement. And there are reasons why it is the commonest. In fact, statistics from the International Society of Aesthetic Plastic Surgery for the year 2017-18 show that 14.5% of all cosmetic surgery procedures in the world are breast augmentation. Breasts are the most aesthetic part of a woman's body. A good-looking breast gives the girl or woman a lot of confidence, self-belief and happiness. Whereas inadequate breasts make the person a little shy, introvert and of course low on confidence. All these factors cause breast augmentation to be the most demanded cosmetic surgery procedure in the world. The operation of breast augmentation takes 2 to 3 hours and the patient goes home the same day. There is no staying in the hospital. After surgery, there is a bandage on the breast for 4 to 5 days, after which the bandage is removed. A smaller bandage is kept and in about 10 to 14 days, all bandages are removed. The breasts are enlarged permanently. They never become small again. Unlike when you have a child and you breastfeed the child, during lactation, the breasts become bigger and fuller in size. But once breast milk stops, in many cases, the breast becomes small again. There are no side effects whatsoever of breast augmentation. There are a lot of myths. If you have a child after breast augmentation, you can normally feed your child, there is no problem. There is no detriment in the interpersonal relationship between husband and wife after breast augmentation. In fact, the attraction between the opposite sexes increases after breast augmentation. Many times, when a couple is married for 4, 5, 6 years and have lost that charm of a marriage, a breast augmentation surgery after 6, 7, 8 years of marriage actually rekindles that attraction, that love, and that spark rises all over again. There is no link whatsoever also between breast cancer and breast augmentation. A lot of wrong ideas and myths are there. In fact, many cases of breast cancer, once the breast has been removed, are reconstructed using an implant. A variety of implants can be used. The commonest implant is a silicone gel implant. Saline implants can also be used. They were much in vogue earlier, but the difference in the feeling of a gel implant is so much better than a saline implant that gel implants are almost always used in all cases. What size of an implant can be used depends on the laxity of the skin of the breast. Tight skin breast with no place, you cannot put in a big implant. Whereas the breast skin is loose, there's a lot of space, you can make a good big enlargement. To put in the implant, I have to make a cut. There are 3 places I can make a cut. I can make a cut in the nipple areolar complex, the junction of the nipple dark skin and the normal breast skin. I can make a cut below the breast, or I make a cut in the armpit. 65% of all breast augmentation is through the nipple areolar complex, the junction, because you don't see a scar. Once it's healed properly, there is no scar visible, no telltale sign, and nobody can know whether it's an original breast or an implanted breast. The cut below the breast is also used commonly. About a 2-inch scar is there, although it's below the breast, but it is there when you raise the breast. The armpit scar incision is not a good incision because it is difficult to place the implant nicely in the pocket, and also whenever the patient raises her arm, you can see that scar in the armpit. I have done more than 700 breast augmentations from now since 1996, 22 years. It is a very common practice we do. Patients are very happy, very satisfied, and it creates a huge new look and feel to your personality. So in case you have small breasts, you are unhappy, you are bothered, you are dissatisfied with your looks, please don't hesitate. Come to us. We will do what is required, give you a good breast enlargement, and you shall have a new life to look forward to in days to come.